Jack Kennelly and I live here in Mendota Heights. Last June I ripped my right calf muscle, and after about a week of pain I decided to call physical therapy and see when I should start my PT. And the physical therapist said, I wished you would have started it about a week ago. Get in here as soon as possible. So I started the next day. Well, even on my initial appointment they knew I was coming, so they greeted me by my name. And yes, there's a little bit of paperwork to do, but luckily they had sent it to me beforehand and I had it all completed. Some of it could be done online or the paperwork could be just brought in. Once I met with Trish, we did our first session and they scheduled my second follow-up appointment in about 10 days. I had no idea whether I would need surgery or not. To the best of my knowledge, I just ripped my calf muscle and surgery was the furthest thing from my mind, and hopefully I didn't want to have it. But everybody I talked to said, when are you having surgery? It's like, I don't want surgery. So I decided, well, maybe I should find out about physical therapy first or get their opinion about when I would have to have surgery. And found out that by working with exercise and stretching, probably the key word was stretching, that eventually, hopefully, I would not have to have surgery and it would just get back to normal. Probably what I like best about working with Trish is she listened to how my prior workouts were, and she was able to develop a PT sessions that I could actually do on my own. The first time I came in, I could barely walk, so everything I had to do was just simply at home. It was some basic leg exercises 2 or 3 times a day. And I was pretty much in pain, but she said come back in 10 days, and I actually liked that idea that I wasn't coming in like weekly or daily.
I've been working with Jack here for a few months. He originally came in with a calf tear. On his first day, he was in pretty tough shape. He couldn't walk hardly at all. He couldn't push off when he was walking, and he was having quite a bit of pain. In fact, I could barely touch it on the first day. This is kind of our final follow-up, and he's been doing really, really good. We got him back into the boxing gym. He doesn't really have any restrictions besides what he was limiting himself to before. He sent me a video the other day of him on the bag for 2 minutes in the boxing gym, and it was just phenomenal. His mobility in his leg looked great, and he got his wind back too, and he's pretty much back to where he was before. And so yeah, he's doing really great. We worked a lot on strength, and one of the main things that we did in the beginning was he was so tight in his calves, which was what predisposed him to his injury. So what I'm doing right now is just to try to increase the mobility of that calf, and also increase the blood flow a little bit, which helped us to restart that healing process and kind of get him back faster than we anticipated he would.
Well, I think the progress was best described by Patricia on my second visit, where she couldn't believe I was walking in without pain. I was still limping, but the pain itself had gone. I just decided I was just going to be patient with myself and just stay away from the gym as long as I had to, and just do exactly what I was told. And yet every time I came back, they just saw more and more progress. OSA is a great place to come. Number one, they've got multiple locations. I lucked out, it was 5 minutes from my house. So as I could barely get in the car and get over here, I knew I could get here and make it back pretty easily. Like I said earlier, what I like best about the OSI people I worked with is they listened to what my objectives were and worked around what I wanted to be able to get back doing.